home-based records, or HBRs, have different names in different countries, such as vaccination cards, child health cards, maternal and child health booklets, and others. The design and content of the cards vary. However, there are some common guiding principles to help ensure that the content is easy to read, that the design elements are understood, and that health workers and parents and caregivers can use the cards. The format of the card can assist users with health actions and understanding health messages and services. The HBR also functions as a reference and recording document for various users. The main users of the HBR include public health administrators and managers, health workers and community health workers or local health volunteers, and parents or caregivers. The immunization section of these cards is critical for reporting and tracking of vaccines that an individual has received and on what date, as well as a reminder for parents or caregivers of when to return for the next vaccination session. The HBR is particularly needed for infants for the first 2 years from birth. HBRs should be kept and stored in safe places to prevent damage or loss, including over a period of years. For example, a parent may need the HBR as evidence of the child's vaccination 3 to 4 years later when the child enters school, if the family travels internationally, or they move to a new location. As a new cohort of infants is born every year, it is necessary for effective immunization program management and reporting that blank cards are available for each birth. Card redesign should not delay card production or printing, as stock outs can result, which is detrimental to the immunization program. Home-based records are part of several immunization data tools and reporting forms that are used in health facilities around the world for calculating coverage and monitoring performance. Number-based tools like tally sheets, coverage graphs by antigen, and monthly summary reports provide visibility on program achievements and gaps and reporting coverage in the health system. Name-based tools track who is being vaccinated and identify which individuals need to come back for the next vaccinations according to their immunization schedule and age. Without name-based tracking, it is difficult to know who is being missed or may be defaulting on completing their series of vaccinations. The due dates in the cards also assist parents or caregivers to know that the dates the child must be brought back to the immunization session for the next vaccines. These reminders are important to prevent a child from missing vaccinations. Additionally, the HBR is also important for health workers and for reporting. It is a name-based tool that assists with tracking the vaccinations each child has received, and women in the case of tetanus toxoid vaccination, and girls for HPV vaccination. The HBR also helps health workers, community-based health volunteers, and community workers to compare name-based information for vaccination with the community register, as well as the immunization health facility register, to cross-check and compare the data. This is also referred to as data triangulation. When the name, number, and dates on the HBR corresponds with the name, number, and dates in the register, this helps to ensure that each individual's vaccination status is appropriately entered. This contributes to quality data and reporting. This guide can help you look at the situation with the HBR in your country, health system and facilities to determine if you have any gaps in HBR use and availability and to avoid stockouts or problems with HBR use. It can also help you to discuss the HBR and address these gaps with health staff, as well as with other partners, donors, and the communities and families you are working with. The annexes provide some references and examples of questions that you can ask to understand the HBR situation. Additionally, the examples in the annexes illustrate ways that you can present the information to stakeholders and partners to help strengthen support for the availability, use of the HBRs, and immunization data quality. Similarly, the Health Worker Guide is a reference to help with the HBR management, monitoring, and use between health workers, community workers, and parents and caregivers. It provides examples for several countries on messages to discuss with communities and caregivers, job aids to use in trainings and communication activities, and uses scenarios and case studies for group discussions and peer-to-peer learning. We hope that this video has given you some useful tips and ideas on how to improve the availability and use of home-based records or vaccination cards. Please read through the reference documents at jsi.com/home-based records project and adapt them to your context. If you have additional questions, you can contact us via email at immunization@jsi.com. Thank you.